In Tech Matters, a new CIO and real talk about interoperability at the Department of Veterans Affairs. This month, VA Secretary Robert McDonald said electronic health records are key to improving medical care for our nation's veterans. The ultimate goal, move the VA and Department of Defense to a single system. So far, it's been a pretty rocky road. For more, I'm joined by Adam Mazmanian, Executive Editor at FCW. Adam, let's start with a state of the state. The House Oversight and Government Reform Committee held a contentious hearing on October 27th. What did we learn about the effort to share health data?
Well, we learned it's going very slowly and that it's quite hard to do. The VA and the Department of Defense separately maintain large systems that separately serve populations of millions of people, cost billions of dollars to administer, and sharing data between them is not as easy as members of Congress would like it to be. The two agencies put together a program to see if they could combine their systems. They spent about $560 million over the course of 3 years and decided that for the time being they still have to go their own way. And for members of Congress, they see that kind of apparent waste and inactivity, and they don't take it well. So it was a tough hearing for a lot of the witnesses.
And how will the multi-billion-dollar contract awarded to Cerner impact this discussion?
Well, that's an interesting question. I mean, Cerner is a private company that won a big award, as you said, from the Department of Defense to build a commercial, off-the-shelf health record system that covered the 9.5 million beneficiaries in the military's health system. They are a private system. They are already pretty much state-of-the-art in terms of being able to share data or interoperate with other existing systems. And so the DoD is hoping to get to full interoperability with private systems, eventually with the VA system, that way. But some members of Congress still don't like it. I don't know that they'll be able to influence the process very much, but what you heard from a lot of the members of the committee, especially on the VA side, was that they would really like to walk back this procurement. They still want a single system for both agencies.
Now, meanwhile, the CIO office at the Department of Veterans Affairs looks very different today. Laverne Council is in, Steph Warren and Stan Lowe are out. Tell us more.
Well, Laverne Council was nominated by President Obama to fill the job of Assistant Secretary and CIO at Veterans Affairs. She's the only Senate-confirmed CIO in the entire government. And what she's been doing is she took over for a department that was troubled, has well-known morale problems, and has started, I guess you'd call it cleaning house. A lot of the top executives that were there before are now gone, and she's looking to reorganize the offices, putting program managers front and center, building new offices to take care of some of the big, knotty problems facing the agency. And one of the big ones in tech is modernizing their own health record system, VISTA, an open source record that was developed independently by the Department of Veterans Affairs and continues to be an issue about what its long-term prospects are.
Now, your colleague at FCW, Sean Lingus, writes that McDonald has made modernizing VA's IT a key piece of his plan to move the agency past scandal. That's a very broad goal, but what needs to happen to make it a reality?
Well, that's a big question. I think a few little things that you'll see that will show if he's succeeding or not is whether the agency can put in place new scheduling software. You'll recall the scandal that occurred when it turned out at different medical centers were sort of cooking the books, if you will, and marking patients as having been seen or having been put off waiting lists when in fact they had not been seen. So that's going to be a big issue. Another big issue that McDonald wants to achieve is having a single front door for all veterans, a kind of front door for the VA for them to access health records and any other issue, grants, education benefits, GI Bill, and go to one place instead of the 17 or 18 or 19 or more websites that the VA maintains for beneficiaries to claim benefits.
It's a daunting task. We wish the VA all the best. Adam Mazmanian, Executive Editor at FCW. Thanks, Adam.
Thank you, Morris.